Good evening, ladies and gentlemen. Welcome to another edition of Microbiotics BioTalk. It's been a while. Of course, the short break has been filled with a lot of activities, and definitely we never ever forget our obligation that we should be sharing information that are worthwhile to the public concerning their health and well-being. And today we'll be talking about Peptic Ulcer Disease. Briefly just scan through it so that people will have an idea of what it is, the causes, diagnosis, and how it can be managed. So we'll give a short 10-minute talk about it, and then we'll redirect people to where the original article is so that they'll be able to go through it and get some good information for themselves. So stay tuned, we'll be back. So, Peptic Ulcer Disease, PUD, is actually characterized by the kind of discontinuation of the inner lining of the gastrointestinal tract, and this is because of the gastric acid secretion inside, and or probably the pepsin enzymes that is also found in the GI tract. In simple terms, the inside of the stomach or the intestine, once there is an issue with the inner lining, the wall, then that's actually a peptic ulcer disease. And we have a lot of causes for peptic ulcer, but there are two prominent ones. The first one is caused by Helicobacter pylori, a very dangerous organism that we'll be talking about later. And then the other one is caused by drugs that we refer to as NSAID. NSAID. These are non-steroidal anti-inflammatory drugs, which are actually very common around us, like Panadol, aspirin, ibuprofen, diclofenac, and the likes. So these are the major causes. We also have some other causes as well, which are actually the prominent one, which resemble NSAIDs, are medications. Medications can also cause it. Medications such as corticosteroids, potassium chloride, and others. So these are basically the common causes. We have other causes, but let's focus on these three types. And of course, PUD is a global problem. It's not actually limited to a particular region, though there are some researches that have shown that it's actually common with in black people. Though we once we get more information about that, we'll let you know. And of course, it's also very common in men than in women. Okay, and that's another item that we'll be discussing. We'll be having further discussion on. And the PUD is as a result of imbalance between the protective wall of the stomach and some destructive factors that can affect it. We've already stated two factors, those drugs, the NSAIDs, then we've talked about Helicobacter pylori, the infection, and then of course if you are an immigrant from a developed nation, that's also a risk factor. Those who come from, let's say, a developed country, they emigrated to a less developed country or developing country, they are also at risk. And then, like I said, if you are an African an African American, or you are from the Hispanic ethnicity, there's actually probability of you also getting contracting the disease. So what are the symptoms of peptic ulcer? Of course, we've mentioned that, of course, definitely the inner part of the stomach will be damaged, and a lot of this can be due to so many reasons, but the major signs and symptoms include abdominal pain, bloating, abdominal fullness, vomiting, weight loss, and a lot of other uncomfortable symptoms that is usually unusual. And of course, the signs and symptoms also depend on the location of the disease and the age. And the pain is usually very, very much more nocturnal. It happens when during the night time when people are sleeping. And there's some warning signs that you can see if anybody is being suspected of a PUD. That's if you are losing weight unintentionally, you're not slimming down, it's not intentional, but you're losing weight, and then you're getting some gastrointestinal bleeding, then you're being deficient in iron. Then if you have a family history of people with gastrointestinal issues, then it's likely that you are having it. So of course, to diagnose PUD, it requires your history to be known, a physical examination to be carried out. Then we have some invasive and non-invasive tests that will also be done. And then any patient that is reporting with abdominal pain and fullness is also suspicious. Most of the time, if a patient complains of pain within 2-3 hours of eating a meal, you can also suspect the person. Any patient that is also presenting with anemia and weight loss should also be further investigated, because these are the complications of PUD. So, of course, I've already mentioned stuff about bloating and unnecessary fullness when you eat. So the other things that we're going to mention there about the testing, well, once you go through the article, you'll be able to see what we're talking about. So, of course, we have 2 types of treatment and management for PUD. We have the medical treatment where we'll be exposed to some drugs, which we refer to as PPIs. These PPIs are proton pump inhibitor. We'll read more about them. Of course, if we're talking about Helicobacter pylori, which we're going to do a separate talk about very soon later. So, of course, like all bacteria, this bacterium requires a combination of antibiotics and some PPIs to work on. And when you get to some levels, sometimes you have to go for surgical treatment, especially if the patient is not responding to treatments, and or maybe it has gotten to the complicated stages. So differential diagnosis can also be made, because we have some diseases that look like PUD, but are not really PUD. The first one that looks almost exactly like PUD is gastritis, but gastritis is different, because gastritis is as a result of inflammation, while PUD is either as a result of infection or the abuse or overuse of some particular drug. Then we have other differential diagnosis, which include GERD, that's a gastroesophageal reflux disease, also gastric cancer. We have pancreatitis, and cholecystitis. So So we have all these as differential diagnosis, which need to be taken out of consideration when trying to find the cause of PUD. So, and we also have some other, should I call them life-threatening diseases that may also show similar complications like PUD. We have myocardial infarction. That's usually the first complications. These ones are actually very. This one is actually one of the most dangerous non-communicable disease that we have, because that to do with the heart, and of course we have others as well, but that's usually the common one. Then, of course, like I said, there's so many complications that can happen with peptic ulcer disease. So, but these complications can actually be prevented if PUD is diagnosed early and treated early. Because if it doesn't, then we have a lot of complications like upper gastrointestinal bleeding from the upper part of the GIT. Then we can have gastric obstruction as well, where a part of the GIT is blocked. We can have perforation where part of the GIT, either the stomach or the intestine, is actually perforated, that can lead into the bloodstream, and then gastric cancer. These are the complications. So I hope you've been able to get one or two things. The articles we definitely be attached to this talk, so that people can go through them and read and get more information. We'll be doing a further talk on this, but from the particular perspective of Helicobacter pylori infection. And by the time we do that, we'll have a more robust discussion about the treatment, because the talk will be focused more on the treatment, the antibiotics that one can use, and the drugs for treatment for a lot of people who are actually suffering from PUD. So thank you for listening. Until next time that we'll be having another talk, take care of yourself and be mindful of your health. Bye.